It's time for our Healthy Families with Omni Family Health series. Today's topic is colorectal cancer, and we have nurse practitioner Justina Adangai here with more. Thank you for joining us.
I'm so happy to be here today.
So March is Colorectal Cancer Month. Tell us a little bit more about this.
So March is a month in the year where it's designated for colorectal cancer awareness. So colorectal cancer is, a cancer of the colon, the large intestine, and also the rectum. This is done every year to provide awareness, education on the risk factors for colorectal cancer, genetic factors, education on screening, symptoms, and also treatment of colorectal cancer. As you know, it's one of the biggest leading cause of death in the United States. So education and promotion of awareness is very important.
And so with all of this awareness, is there a way that we can prevent colorectal cancer?
For the most part, yes. Large lifestyle modification and changes are very, very important in preventing colorectal cancer. So things like eating healthy, limiting red meats and highly processed meals, staying active and preventing sedentary lifestyles, smoking cessation, cutting down on alcohol use, and basically general wellness. On the other side, there are factors such as genetic factors, family history of colorectal cancer, and there's also certain groups of people, ethnic-wise, such as like the African American population, who have higher risk of developing cancer. So screening is very, very important for early detection of cancer and to kind of help with prevention as well.
And what are some of the symptoms that these people are seeing when they have it?
Wow. For colorectal cancer, you would see there's a wide range of symptoms. Sometimes in the beginning stages, you might not even have symptoms, but some symptoms that we do see are frequent diarrhea and constipation. You could see rectal bleeding, blood in stools, lots of abdominal cramps and pain. Sometimes you could see like narrowed stools because of possible blockage in the colon as well. And sometimes with the symptoms being vague, it can easily be missed because we have other stomach symptoms that could predispose as this, such as, irritable bowel syndromes can present as such. So people can go for a while without having this checked. But when these symptoms get persistent and ongoing, we always recommend check in with your healthcare provider to have some testing done.
Yeah, I could definitely see why it would be something that would be easily missed. I mean,
Absolutely.
You just sort of ignore symptoms very often. So what are some of the screenings and tests that we can do to make sure that we're not missing this?
Some screenings that we have are colonoscopy. This is the #1 and the gold standard for colorectal cancer screening, where a tube gets in through your rectum and they're able to check everything in your large intestine, your rectum, to make sure there are no polyps or abnormal cell growth in there. We do have other ones that can be done at the comfort of your home, where you present stool samples such as the Cologuard, and we also have the fecal occult blood test, and also the fecal immunochemistry test as well. There's so many other ones that can just be done at the comfort of the home. However, we always encourage patients, even when you get those done, if it does come out positive, you still have to go through with the colonoscopy so we can find out where the cancer is originating, and so that way treatment can be done in time.
And Justina, what age should we be starting to think about doing these screenings?
So very interesting. Most recently, the age has changed. It initially was at 50 years old, but now we have 3 organizations that make recommendation: the American Cancer Society, the American College of Gastroenterologists, and the U.S. Preventive Task Force. They have all agreed and recommended for screening to start at about age 45 for average risk people. But if you are very high risk, so family history, genetic factors, it can actually start earlier, or if you do present with symptoms that warrant for treatment and screening as well.
Yeah, I've definitely been seeing a lot in the news about different diagnosis happening way earlier than it used to.
Absolutely. It is literally like the $1,000,000 question now, why this is happening, why younger people are getting this cancer so earlier on, and this is still being researched. It could be environmental, the things that we eat, but this is actually still being researched to find out why this is happening.
And going into research, is there a cure for colon cancer?
Thankfully, yes, and that is why screening is very, very important to detect early. So based on age, general well-being, and the location and stage of the cancer, we have things like chemotherapy, we have radiation, targeted therapies, we have surgeries to take care of this colorectal cancer. Especially when it's found early, you can have this and go in remission and just kind of have it taken care of so you can live your normal life. Again, screening is important for prevention and for early detection as well.
Great. So good to know there's all these options around screening and testing and cures and help. So what's the best way for people to reach out and learn more about Omni and the services you offer?
With Omni, there's always our 800 number. You can also go online at omnifamilyhealth.org. We have texting capabilities now. You can text and get an appointment. And of course, we have a lot of clinics over 4 counties. So you can walk into one and schedule yourself an appointment to get checked out.
Great. Thank you so much for joining us and giving us all this information.
Absolutely. Thank you.
All right. We'll be right back after the break.